Hi everyone! Today, I'm diving into the pivotal role nurses play during ECG arrhythmias. This is crucial for healthcare professionals to grasp, so let's get started. First up, patient assessment. When a patient with suspected arrhythmia comes in, it's all about gathering a detailed medical history. I need to know about any previous episodes, current medications, and underlying conditions like heart disease or electrolyte imbalances. Next, I assess symptoms. Palpitations, dizziness, chest pain, or shortness of breath are key indicators. Then comes the physical examination. I measure vital signs: blood pressure, heart rate, respiratory rate, and oxygen saturation. Listening to heart sounds for abnormalities and checking for signs of heart failure are also part of my routine. Monitoring and interpretation of the ECG is the next big step. Correct lead placement is critical for an accurate reading, and I always check for artifacts to ensure the ECG machine is functioning properly. Continuous monitoring through telemetry systems, especially for high-risk patients, is essential. If needed, I set up a Holter monitor for longer-term monitoring. When interpreting the ECG, I analyze the waveform: rate, rhythm, P-wave, PR interval, QRS complex, and QT interval. Recognizing life-threatening arrhythmias like ventricular fibrillation or ventricular tachycardia is vital, as these require immediate intervention. Now let's talk interventions. Pharmacological management involves administering antiarrhythmic drugs like amiodarone or beta blockers. Monitoring the effects of these medications and watching for side effects is equally important. Non-pharmacological interventions could include electrical cardioversion or defibrillation. I prepare for these procedures, ensuring all safety protocols are followed. Vagal maneuvers like the Valsalva maneuver can also help terminate certain types of supraventricular tachycardia. In an emergency, I'm ready to jump into advanced cardiac life support protocols. This includes chest compressions, airway management, and administering emergency medications. Having resuscitation equipment on hand and functional is a must. Patient education and support are also key roles. I explain the nature of the arrhythmia, potential triggers, and the importance of sticking to treatment plans. Advising on lifestyle changes like reducing caffeine intake or quitting smoking is part of my job. I emphasize medication adherence and educate patients on when to seek help. Documentation and communication wrap up my responsibilities. Accurate record-keeping of all assessments, interventions, and patient responses is crucial. Attaching ECG strips to records and noting associated events or symptoms helps maintain a clear medical history. Effective communication with the healthcare team, including cardiologists, ensures cohesive patient care. Thorough handoff reports during shift changes help maintain continuity of care. So, as you can see, the role of a nurse during ECG arrhythmias is multifaceted and vital for patient outcomes. It's a blend of technical skills, clinical knowledge, and compassionate care. Thanks for watching. Stay tuned for more insights on healthcare practices.